I'm Dr. Saran Nasir, and we are going to be talking about the pathophysiology of opioid addiction and recovery, as well as what to expect when you are seeking a treatment with medicines such as methadone or Suboxone, which is also known as buprenorphine, and that's what I'll be referring to it as. Methadone is a pure agonist, just like heroin, fentanyl. So, what it does is it goes and it binds to the opioid receptors in your body. When the opioid receptors are activated, they will be releasing dopamine, which is your reward hormone on the other end of it. Normally, our body releases these hormones to make you feel rewarded for doing something or achieving something that is naturally pleasurable. This acts as a motivating factor to keep going and growing. However, when there is external chemicals such as heroin, fentanyl being introduced into the system, it hijacks this reward pathways. And we're going to go into how that works. The other medicine that we use is buprenorphine, which is a partial agonist, is what we call it, which means it acts sometimes like an opioid and sometimes like a Narcan. I like to call it the jealous girlfriend or boyfriend. And so, what that means is when you have other opioids attached to the receptors, such as heroin, fentanyl, or methadone, and you have buprenorphine in the system at the same time, the buprenorphine gets really jealous and it knocks off all the other opioids into the receptor. So, in some ways, it makes you have a precipitated withdrawal by acting like an antidote, which is what Narcan is. Narcan's job is to just come and knock everything off the receptors. And then buprenorphine, when there's no other opioids in the system, you have just the receptors, then it's all lovey dovey and it likes to just sit on the receptor and makes it feel better and stabilizes it. Now we're going to talk about the pathophysiology of addiction and recovery from opioids. So, this is the story of Pete and Tish, is what I've named these guys. This is Pete. He's a normal guy at this page. The picture that you see here with this ground beneath his feet, this is the example or metaphor for your body's natural metabolism and its ability to maintain balance, which is called homeostasis. And when your body is in the right range, it feels good, it is not feeling any pain or any discomfort, and it's functioning perfectly. However, any shift from this can lead to worsening and disease, basically. So, what happens is this person is somebody who does not have any history of chronic opioid exposure, either as a prescription or as recreation. However, when you start to introduce these chemicals into your body that is not natural for it, what your body starts to do is one of three things. The first thing it does is it starts to make less of the natural hormones that is circulating in your body, known as the endorphins. And the second thing it does is it starts to pull the receptors away. So there are less available seats for it to bind to. And the third thing it can do is it can amp up the clearance of the opioids and other chemicals in your body. These are all done to protect your body from getting into overdosing and dying or being checked out. So when a bear comes to attack you, you're not just standing there not doing anything. So, when you're being exposed to these chemicals on a regular basis, your body starts to change itself in three ways, and it shifts its threshold to a different level when it feels like you're at the bottom of a hole. And this is where your body does not function regularly. So you feel all the withdrawal symptoms that makes you feel miserable, and you experience cravings that makes you want to go use because your body is basically trying to push you to go back towards normal. Those withdrawal symptoms are like fire alarms, and the cravings are like the push to run towards safety. So what people end up doing at this stage, where they don't realize what's happening with their body and they're not trying to get the help from a professional who understands what's going on, they go and they continue to self medicate and to feel better. And at this stage, because they don't know what's happening in their own body, Pete and Tish will use more than normal because they're trying to have a good time, not just to feel stable. So when you're using more than what you need to get up to cloud nine, that means also that the pit gets bigger as well. The hole gets bigger, the chemical gap, as I like to call it, worsens because your body changes itself even more. So it puts itself in a further deficit where it cannot make up for that chemical imbalance anymore. And so what happens is you get caught in this vicious loop of using and hurting, going deeper and deeper until you're at this stage where you're like, I'm done with it. I want my life back and I don't want to suffer like this anymore. But the only reason I can't kick it is because I keep feeling so bad and I can't climb out of this hole. Because your body at this stage has come so far from baseline, it cannot go back up to itself normally. So then starts your journey to getting treatment, and this is what you should expect when you are trying to get a proper treatment. You should be going through the 3 stages of medication assisted treatment. I'm going to flip right here. This is the 3 stages of medication assisted treatment. The first stage is going to be the induction phase, where you want to find how much methadone you need to feel stable. The second phase is going to be maintenance phase. That's where you hold steady at the therapeutic dose that you found. And you want to hold it for at least 1 year to let your body shift. And the last phase is going to be the taper phase. And I'm going to talk more about it in the next section. The taper phase is where we lower your methadone dose a little bit at a time and allow your body to heal and come back up. So coming back to this picture and to this situation of where we're in the first phase of the addiction, our goal is to get you stable on the right dose of methadone or the buprenorphine. Our goal is to replace what you're having to use to get to the stable point where you feel normal. And, we are the doctors, we're not the dealers. So our goal is to get you stable so you can move on with your life and continue to recover. We're not going to take you up to cloud nine. And thus, we stop the process of the chemical gap worsening. What happens when you reach stability is that your body stops feeling like it needs to focus on survival and it starts to move towards healing. And that's where the second phase of this treatment process of the maintenance phase is so crucial. This is actually where most of the work gets done. This is where your body is focusing internally on healing and fixing itself and rebuilding itself. It's no longer worried about survival. And what you are supposed to be doing at this time is helping create a lifestyle that's going to help you maintain sobriety, a life of resilience, so you don't keep relapsing again and again. You want to take care of 6 dimensions of you when you're doing this. The first dimension is your physical health, which is where if you have any other health conditions, you get that treated and taken care of. The second dimension is your mental health. If you have other conditions like PTSD, depression, anxiety, bipolar disorder, or schizophrenia, get that under control because a lot of times people are self-medicating to self-treat those and they get caught up in this vicious loop instead. And the third dimension you want to treat is your spiritual dimension. If you have a higher power that you ascribe to, you want to make sure that you're also taking care of that part of you. Many people draw immense energy from that. The fourth dimension is the relationship or social dimension. This includes your family, your loved ones, your work, your friend circle, your community circle, volunteering, etc. Whatever circle that you need to feel important and as if you have existed. You want to make sure you're good on those. Other things could be legal aspects as well that can interfere significantly with your social life. The financial aspect is the other one. That's another health you want to take care of. If you're in debt, if you need to get a job, get those in order. And the last one that I encourage patients to focus on is their aspirational health, which is finding purpose and using that to propel you towards where you want to go. A lot of people feel they use drugs because they're bored. And if you have a purpose, you don't have time to be bored because you're too busy growing and living, naturally getting high on life. Then comes the last stage of the treatment phase, which is the taper phase. This is where we will be dropping your methadone a little bit at a time such that your body doesn't realize we're coming down. That is the best taper. As we're dropping the dose a little bit at a time, it's acting as stairs for your body to come back up towards normal level. This is like training your muscles. You do not want to go from couch potato to 500 pounds bench pressing. That will break you. And that's what happens when you're doing these spikes and crashes. It breaks you and it tries to takes everything in your body just to keep yourself together. Versus when you're doing this, our body does amazing with adapting to gradual changes. So that is what we're trying to capitalize on this stage. That's the taper phase. And the ultimate goal is for you to have a life of success and thriving in the way that you want with your family in all dimensions of your existence. Some people, they're unable to come back up to this level. If they have a body that just cannot heal as properly, then they might need to be on some sort of medicine for the rest of their life if that's what it takes. But the goal is to get you to the lowest dose you need to be. So, that being said, thank you so much for listening to my spiel about what to expect in this treatment. And I hope that this made sense and it helps you in the process.